Ladies and gentlemen, all healthcare workers are not going along with taking the shot. This came out in LA Times, December 31st, 2020. Some healthcare workers refuse to take the COVID 19 vaccine, even with priority access. So, right now, they can get the shot if they really want it, but many of them are saying they don't care. They're not taking it. They are frontline workers with top priority access to the COVID 19 vaccine, but they are refusing to take it. At St. Elizabeth Community Hospital in Tehama County, fewer than half of the 700 hospital workers eligible for the vaccine were willing to take the shot, even when it was first offered. At Providence Holy Cross Medical Center in Missions Hills, 1 in 5 frontline nurses and doctors have declined the shot. Roughly 20 to 40% of LA County frontline workers were offered the vaccine, did the same, according to county public health officials. So many frontline workers in Riverside County have refused the vaccine, and estimate 50%. The hospitals and public officials met to strategize how to best distribute the unused doses, public health director said. Yeah, because nobody wants that mess. The vaccine doubt swirling among healthcare workers across the country come as a surprise to researchers who assumed hospital staff would be among those most in tune with the scientific data backing the vaccines. The scientific evidence is clear regarding the safety of the vaccines after the trials of tens of thousands of participants, including elderly people and those with chronic health conditions. The shots are recommended for everyone except those with a severe allergic reaction to any of the ingredients. Still, skepticism remains. April Liu, a 31-year-old nurse at Providence Holy Cross Medical Center, said she refused to take the vaccine because she was not convinced it was safe for pregnant women. She's 6 months pregnant. Clinical trials have not yet been conducted on pregnant women to take the vaccine, but experts believe the vaccine is unlikely to pose a risk, according to the Center for Disease Control. The agency says pregnant women may choose to be vaccinated. I wouldn't do it if I were pregnant. I don't blame her. I'm choosing the risk of having COVID or the risk of the unknown of the vaccine, Lou said. I'm choosing the risk of COVID. I can control that and prevent it a little by wearing a mask, although not 100% for sure. Some of her coworkers have also declined to take the vaccine because they've gone months without contracting the virus and believe they have a good chance of surviving it, she said. I think people think I can still make it until this ends without getting a vaccine, she said. A lot of people feel that way. The extent to which healthcare workers are refusing the vaccine is unclear, but reports of lower than expected participant rates are emerging around the country, raising concerns for epidemiologists who said the public health implications could be disastrous. A recent survey by the Kaiser Family Foundation found that 29% of healthcare workers were vaccine hesitant, a figure slightly higher than the percentage of the general population, 27%. Even the name Operation Warp Speed draws some concern for people about the rush to, a lot of people, yeah, I agree with that. I did see articles where a lot of people don't even like the name of the project, Operation Warp Speed. Okay. It's certainly disappointing. Sal Rosalini, a president of the National Union of Healthcare Workers, but it's not shocking given that the federal administration has done over the past 10 months trust science, but about science and reality and what's right. The consequences are potentially dire if too few people are vaccinated. The pandemic will stretch on indefinitely, leading to future surges, excessive strain on the healthcare system, and ongoing economic fallout. Well, you can expect that because, whenever you have a lockdown, you still got these very defiant people out here, and those are the ones spreading it too, by the way. Now, they'll deny it, but they are the ones spreading it and keeping it going. So, as long as you have that situation, you can best believe COVID is indefinite in America. That sure is the way I see it. Our ability as a society to get back to a higher level of functioning um, depends on having as many people protected as possible. Harvard epidemiologist Mark Lipsitz. Well, Mark, you get out there and take the shot. That's all I got to say. So as you can see now, if the healthcare workers are having a lot of reluctance, ladies and gentlemen, you can best believe the people that aren't even in healthcare is going to see that and say, you know what, I don't want it either. But many of us have already said that long before this article has come out. And it just go to show you they work around COVID patients every single day and they still don't want the shot. They still don't want it. That says a lot right there. So I'm not shocked that the general public is not feeling this stuff either. So out of 2 million, they already gave out, they gave out 2 million shots after saying they wanted to target 20 million. I don't even think they're going to reach 20 million in January, y'all. I really don't. This thing is just moving very slow. Now you got the new strain of the COVID mutant, or some people say it's the virus variant in the US, Colorado, California. You can best believe it's all over. They just happen to detect it now, but it's everywhere. I wouldn't even doubt if it's in my state. I really believe it's here. But y'all, please tell me what you think. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.